But I am really excited to talk about some of the work that we've done over the past year, as well as some of the things that we're working on. And as I go through this, when we're talking about research and doing research together, we're not just talking about answering questions. We're really looking for insight, and we're really looking for data to help drive us forward. And I think you kind of heard that earlier, but this is really, we're looking for very meaningful things in what we do with these projects and how we're collaborating with you. And we're finding that. And so that's what I'm going to take you through today. So through research, we're really looking to bring value to all parties, to Fairview, to you guys as our partners, and especially to patients like Dan and Carol, who I'd like to introduce you to. So Dan is a self-employed contractor. Carol is a stay-at-home mom. They have 2 children, a tabby cat and a dog. Dan loves to fish year-round, like a true northerner. And they love to spend their family vacations in their RV, traveling around to the different national parks. Dan used to smoke, and he has emphysema now. They're both a little overweight. Carol makes sure that they get their routine exams, since their health isn't as good as they would like it to be. Both Dan and Carol are proud people, and they value their independence, even when it comes to their healthcare decisions. At Fairview, as you've heard today, we're here to provide exceptional care to every patient, every Dan, every Carol, every day. So we did a study with partners at Carrot Health to answer a fundamental question at Fairview Pharmacy. Do patients who use our community pharmacies, like Dan and Carol, get and stay healthier? And as you can imagine, we were very interested to learn the results of this. And here's what we found. Patients who consistently use our retail community pharmacies that are in our clinics had 9% fewer visits than a comparable group of patients who weren't using our pharmacy. When we break that down, they had 6% fewer outpatient visits. They had 6% fewer emergency department visits. And they had 22 fewer inpatient visits. In addition, of those who were admitted to our hospitals, 21% of patients who consistently use our pharmacies had 21% fewer 30-day readmissions. So this is really exciting. And if you're Carol and Dan, it means more than just staying healthy. It means they have more time to do the things that they love, like traveling to the national parks with their children. So because of this study and others like it that I'll share with you today, we have data that shows both how we're improving the health of patients, like Dan and Carol, and how we can enhance our clinical operations to further improve outcomes. So what we've learned is exciting, and it's my privilege to share some of this with you today. So I'm going to go through some of the questions that we're researching together, some of the questions that we at Fairview Pharmacy are researching internally about our services. We'll go through the answers to many of those questions, and then we'll talk about what it is that we can do to continue this progress and collaboration moving forward. So all great research projects start with a great question. Carrot Health helped us to answer the question, do patients who receive care at our clinic-based pharmacies have better outcomes? And these are some examples of other questions that I'll elaborate on here moving forward. So several years ago, Fairview Pharmacy Services built services to support our mental health clinic at the University of Minnesota. One of the services that their pharmacists provide are to manage the REMS program for a product called clozapine. This product, REMS program, requires very intensive monitoring of these patients in order for them to persist on their medications. And so we asked the question, are patients who are enrolled in our clozapine monitoring program keeping up with their medication? And what we found was very exciting. So through this analysis, we learned that patients who were part of our clozapine monitoring program that our pharmacists were facilitating were almost 4 times more likely to be persistent on this medication just within the first 90 days. So they were incredibly successful in helping them get over that initial hump and continue to maintain all the requirements that are needed for these patients to receive this important medication. One of our large focus areas for our specialty pharmacy is cystic fibrosis. Over the past several years, we've invested a lot of infrastructure and staff to help support our patients with cystic fibrosis, not only in our specialty pharmacy, but also those in the clinics. And these patients are also serviced through our home infusion business for products that they're receiving in the home for part of their treatment. So we asked the question, what is the impact of all of these cystic fibrosis services that we're providing across our system? And because of the complexity of the regimens within this disease state, adherence became kind of our key metric. And what we found was that for patients who are receiving their cystic fibrosis care through Fairview and Fairview Pharmacy Services, they were 70% higher in their adherence metric than a comparison study that we used to develop the methods for this. So very exciting to see kind of the impact that we're having for this very complex patient population. As I mentioned before, Carrot Health helped us understand that patients who are using our community pharmacies may in fact have better health outcomes. And one of the reasons this may be is because of our improvement as a result of our blood pressure monitoring program. So our community pharmacies have a program where patients can come in, they can get their blood pressure tested, they receive education and follow-up recommendations from our pharmacists. And the pharmacists, because of our access with the EMR, are able to put all of that information plus any medication recommendations directly into the patient chart. So with this program ongoing, we wanted to know, what was the impact of all of this work that our pharmacists were doing on our patients meeting their blood pressure goals. And what we found was that over the course of a year, patients who were enrolled in the program had a 22% increase in medication fills as compared to the year prior to their enrollment. In addition, at the end of that year, 40% more patients were reaching their blood pressure goal. And finally, from an internal question perspective, Fairview implemented a system-wide care transitions process that, among other things, referred patients who were discharged from a Fairview hospital to outpatient services provided by our medication therapy management pharmacists. So naturally, we wanted to know, what is the impact of these patients seeing MTM on their hospital readmissions? And what we found was that overall, among patients who received an MTM visit, they had a 33% lower 30-day readmission rate than patients who did not. Even more, when we looked at the risk of readmission for those patients and stratified our population, we found that patients who were at higher risk of readmission actually benefited more from the MTM services that they were receiving as part of their transitions of care. So this information and insights made it really easy to make decisions about expanding transitions of care programs as serviced by MTM providers to other high-risk populations, such as our mental health and patients in our psychiatry clinic. So we're also working on a number of questions that we're addressing together with partners like you in the audience. As Kyle mentioned earlier, Amgen was our 2017 Piranha Pool winner. And so we're currently evaluating the question of what is the incidence of febrile neutropenia in our oncology population. This particular project was successful in launching and and getting off the ground, because Amgen had done a lot of groundwork even prior to submission to the Piranha Pool. So they had done amazing work in identifying key stakeholders across the system, key partners in the oncology service line, connecting dots around who may be the right analytic resource. So when the time came for us to evaluate their project as part of Piranha Pool, it was easy for everybody to raise their hand and say, yes, we get it, we understand, we're all connected, and we have all the right people in the room to help move this forward. In addition, they came with a very nicely, narrowly scoped project. So it was really easy to understand kind of what were we going to do first, and how is that going to lend itself to having potentially very profound impact on our patient population, which with febrile neutropenia can be very severe for patients and is one of the most serious complications for patients receiving chemotherapy. So it was also very easy to see this profound impact that we could have and exactly how we were going to get there in a very nicely, narrowly scoped time frame. In addition, as Kyle mentioned too, we just presented kind of our final results of that initial analysis yesterday. And in case you're all wondering what's happening next, we are continuing to work with the oncology service line to understand potentially can we insert different risk factors into our EMR? Is there additional analysis we can do? And ultimately, we hope to put that information out into the public domain. So we'll have more to share with you at a later date. Also, as a result of our 2017 Piranha Pool, we worked with Pfizer to answer the question, what is our opportunity to improve treatment rates for patients with non-valvular atrial fibrillation? So Fairview cares for about 10,000 patients with non-valvular atrial fibrillation, which is a type of regular heartbeat. When Pfizer first presented this, they had some compelling evidence from the literature that suggested that treatment rates were not optimal across the country. And when they came with their presentation, they came with a toolkit that had a very clear idea of what we wanted to look at, what were the codes that we needed to use in the EMR, and what would the ultimate outcome of that be. And through that initial analysis, we were able to very quickly identify that we too may have suboptimal treatment of NVAF within our patient population. And in addition, we could also look at kind of where would be the optimal place to potentially pilot something to help improve those rates. So right now, we're currently in the process of we actually built the risk calculator in our EMR to help support our physician decisions when they have patients with this condition, and are moving forward to ultimately kind of understand what was the impact of doing this work and providing that support to the physicians in optimizing treatments for this population. We've also been working with Janssen on a question to understand, what are the factors associated with non-adherence for patients who are in our specialty pharmacy who have an inflammatory condition. Patients with an inflammatory condition such as rheumatoid arthritis, ulcerative colitis, Crohn's disease, or psoriasis are our largest specialty pharmacy population. So we had a mutual interest to really understand, what are these factors that may be leading to non-adherence? And ultimately then, how can we better tailor the services that we're offering to patients who may need it most? With a dose titration that included patient education as well as some over-the-counter products to help patients mitigate side effects when initiating a product for psoriasis. Naturally, both Celgene and Fairview had an interest of really understanding, what is the impact of that kit, and is it helping patients to stay on this therapy longer? Like most things in specialty pharmacy, our patient populations can oftentimes be quite small. So this particular project became of interest to the Accelera network, and you'll hear from Accelera next, and you've heard some mention of it before. So we've been fortunate to take this to Accelera and identify willing and engaged partners to also help evaluate this question with us. And it's really exciting for us in the fact not only do we get to engage and partner with other IDN specialty pharmacies across the nation, but it really opens up our insights and knowledge of things that are happening not only at Fairview, but across the country as well. But there's always more that we can learn, and I know that all of you have questions, because I've talked to some of you about them just a few minutes ago, which brings me to what's next. So we've answered a few important questions, but there are endless possibilities to what we can explore and the ways that we can improve outcomes together. Fairview wants to do more research, and we want to do it with partners like you, because we can all benefit. Fairview, your company, and the patients that we all serve. So you might ask, what kind of questions is Fairview looking to do? All told, they kind of fit into 3 buckets. So the first is in the past. So what have we done historically that could benefit from a retrospective analysis and understanding, what have we learned and what insights can be generated from some real-world evidence of things that have happened in our care system. Next is in the present. So can we do something better today? And this really relates to, do we have opportunities for quality improvement? What are our gaps? So we can conduct empirical research to identify those gaps. We can find ways to improve clinical implementation. And we can also survey our patients and providers to understand, what is the voice of our customer and what do they think we may be able to do better. And finally, and you heard a lot about this today, is in the future. So what is it that we can learn that gives us insight into future delivery? And this is really alluding to predictive analytics, which seems to be the buzzword and definitely the theme for today. So how can we use and leverage our data, our insights from the past, to help drive our impact to patient care before these patients are actually in need of that specific care? There are other questions we're exploring as well, specifically from a Fairview pharmacy perspective. We really want to understand, how are we contributing to quality measures that Fairview is being held against? We also want to know, what's the value of pharmacy's work within other Fairview initiatives? And how does our work relate to our most complex patients? Certainly, I think given the vast array of our services, we have a number of complex patients that we're engaging with, and what's our opportunity to service those patients better? And finally, how can we collaborate better, leveraging our collective expertise for everyone's benefit? So I know that everybody's ready to get started, and now that we've done this a number of times, we have some key themes that have been emerging in our projects that have been successful. And all of these projects that we're working on and the ones that I've mentioned have these 4 key elements. So they're all around improving patient care. And as you heard today, our patient is really the focus of what we're trying to do here. Second, all of these projects had a measurable outcome and something that we knew we could understand if we were successful or not. They all addressed a gap that we had. And finally, they all provided mutual benefit, both to you as a partner as well as to us as Fairview, and back to that first piece, ultimately to our patients. So Fairview wants to do research, and we want to do it together. And in working together through our collaborative projects, we've found some other frameworks that we've implemented to help us better work with you as partners as well. So as part of that, we've created a project management structure. So we now have tiered project meetings that we're using to help ensure that things are moving forward and that you guys as a partner have a key contact that you can ensure that you're getting what you need as we move through our projects. We also have now some standard pathways for legal agreements. So we know contracting is our favorite part of all projects. Whether it be a research project, a quality improvement, or we're working with a third-party vendor, we now have some experience and some pathways to help accelerate those contracting options. Analytic resources are always a hot topic, and we have some ways to help identify whether that would be an internal or an external resource that we can utilize for any project coming forward. And finally, we're working to help coordinate across our system. So if it's a project that doesn't necessarily fit just within pharmacy, We can help reach out across the system, as well as a lot of times your contacts. We can help bring that together into the project and make sure that we have the right stakeholders at the table for moving these projects forward. So if you want to get a project started quickly, I also have a few additional tips for you, because we've all been excited about an idea, and for whatever reason, it hasn't really gone anywhere. So to help eliminate some frustration, I have 3 ways that may help overcome some of our obstacles fairly quickly. And the first that I mention is bringing a feasible, narrowly scoped project. So oftentimes, the fewer things a single research study is looking at, the more powerful data you'll get as a result. And having a precise sense of what you're looking into and the methods can help things move a lot more quickly. Next, bringing your company's research team, if we're doing a research project, as well as any clinical champions you've identified within our system, can help jumpstart things right off the bat. So oftentimes, not having the right stakeholders at the table can be a barrier, or at least delay things moving forward. So really, making sure that we have the right team and all the right people up front really helps things get moving very quickly. And finally, if you really want to move forward and get a project prioritized, thinking about how the outcomes of your project and proposal connect with measures that Fairview gets graded against, such as Minnesota Community Measurement or the CMS star ratings. These are always projects that are going to be of interest to us and ultimately, should have a large impact on our patient populations. So a number of you here today have participated in the past or are participating in our Piranha Pool this afternoon, and you've brought proposals to pitch, and they've included all of these criteria, and it works. So we've been able to start multiple projects, some of which I highlighted today, as a result of bringing these things into your project proposal and into the process and working together. So why do we at Fairview and Fairview Pharmacy have this sense of collaboration? Because we believe that the possibilities are profound, because the impact is real, and because the answers we discover could help us all succeed. And most of all, because it will help our patients, like our Dan and Carol, and all of our Dans and Carols, who count on us for healthier futures. So we know that we can do more, and we're ready to get started.